Well, hello and welcome. This is Dr. Jerry Cuomo. I'm here in my Boca Raton office on a Tuesday morning, uh, June 19th, and we're here with my young patient, and we're going to handle a conservative method of restoring teeth numbers number 20 as well as 19. Our patient did have a history of orthodontics, and maybe some of this decay that was encountered might have come from an orthodontic band or maybe a bracket. We looked certain, though we did not find any fractures or cracks in her teeth, so I'm assuming that that might have been the origin. So without any further ado, she's already numb and we are ready to go ahead and proceed. Now, for dental students, this may kind of go against what is learned with the GV Black classification, because we are staying very conservative with her preparation design. So you're going to see some modification of the classic design that is learned in most dental institutions. So just view it with an open mind, and I'm welcome to any comments that you may have. Feel free to do that, and if you do, subscribe if you can, and then you'll get all the videos that you get published immediately through the internet. All right, so we're going to go ahead. I like the fine diamond, a very thin fine diamond. Go ahead and work, and also if anything bothers you, just let me know, okay? All right, kiddo. There we go. All right. Looks like there is a pre-existing restoration on 30. And so let's go to 29 and see what's what. So I think what I'm going to do at this point is ask for a cut band, and let's approach it that way, since there is a restoration in place on tooth number 30. It's like an MO is there already. All right. Now, cut bands are used just to block adjacent teeth so we don't nick them at all. So I'm going to put this in place. Slowly slide that in there. We have a Hollenbeck. And see if I can push that down a little bit further. There we go. You okay? I think we'll take a pair of scissors and get rid of that. Okay, and cotton pliers again. Okay, let's give that to you. All right, good. And that just keeps it nice and out of the way. There we go. Now we're just going to come down the side of the tooth gently. Try to see if I can make this as visual as I can. I'm going on the most distal portion of the distal marginal ridge of tooth number 29. And as I'm doing that, I'm exposing the tooth decay. Now you see the white chalkiness right there? Now that's the decay. Just below or right at the contact. Down about a millimeter and a half. Now usually what's taught in schools is that we would carry this over and do a dovetail for the classic procedure. So I'm basically just doing a small box preparation. And my next step now is to take a half round burr, and I'm going to go ahead and just clean that out. And we'll get a good blow up view of that, and we'll dry it gently. That's good. See how white and chalky that is? So that's the dental caries, or tooth decay. This is a half round burr. We're going to go in and clean that out with a little bit of air. We'll start to see the color change it now. It may change from white to a dark color. We'll see. Looks like it's maintaining. A lot of this is by feel. Okay. How's that? Are we in focus? Oh, good. All right. Now again, for the viewers, as decay starts, it travels underneath, and a lot of dentists are concerned about, do I have enough access to that? Can I see? Can I feel? What am I, am I getting in there laterally enough? Are there going to be any roofs? So I will open this up a little bit more. The old theory of extension for prevention, you've got to be able to gain access. Well, this is my technique as I use a dental microscope. All right, some more air. Now, I'm going to flare this just a little bit more. I'll go back to my high speed, but I may not use water with it. I'm more bird's eye view here, so I'm going to try to move my scope to the right a little bit. Okay. See if that helps. I'm flaring this wall a little bit. So that's the lingual wall. And there's the axial wall there. I'm flaring that a little bit. And the buccal wall. I'm going to get a little more surface area. Okay, so we'll go in with some air. There we go. So I want to try to get as much as I can done with the band on. And you notice I haven't nicked that adjacent tooth at all. So I want to get a good look at all that. So I'm going to ask for my scaler now. And you can see that little piece right there, right at the gingival floor. Right down in there, you see that? That's decay. So I'm scaling that by hand. There. That's gone. Now, what I haven't done is check under the buccal and lingual shelves. I'm going to do that now with my mirror. And I'm also going to use a fiber optic light that's separate from the ring light that I have. See how this shows. You may or may not see any of this. So the buccal wall looks clean. I'll come around and check the lingual wall. Get my mirror down there. Alright, kiddo, I need you to turn left a little bit. Good. Now I'm going to bring you back a little bit. And we'll get right back into that focal length. There we go. Let me take a look at that with our fiber optic light. So, looks like we still have a little something down in there I have to clean out. So, we'll continue. That's fine, yeah. Where are we? Oh, here we are. All right. See, the surface of the distal wall itself of this tooth is convex. And so dry, please. Here's my Explorer now. And dry again. And that's always that proned area. It's just on the corner of the pulp or the gingival floor and the lingual wall, and that's the extent of the decay, and it can't be neglected. So you have to clean that and at least forcefully break up any loose enamel that might be down in there. And then once we remove the metal band, we'll go in and scale that and smooth it some more. Alright, so I'm going to double check my buckle now. I kind of like that. Let's see. I'll feather it just a little more. So basically what I've done is created a nice flared distal box and with a lot of surface area to bond to and bond strength. Alright, so we're going to pick this up on our next video. This is Dr. Jerry Cuomo. We just completed the Class 2 distal box preparation of number 29. Conservative, of course, kind of goes against the grain with GB Black's classification. But we'll welcome your comments, and we'll pick this up on the next video. Thank you for watching.